Today, the 31st of May, South Sudan has joined the rest of the world in marking World No Tobacco Day. According to World Health Organization, the tobacco epidemic is one of the biggest public health threats the world has ever faced. Tobacco kills around 6 million people each year, both as a result of direct tobacco use and second-hand smoke. Tobacco use harms nearly every organ of the body, causes many diseases. And despite the vast awareness of the dangers of tobacco smoking, trends continue to grow in popularity in developing countries, and South Sudan is not an exception. It is for this reason that the United Nations Association of South Sudan, in partnership with the South Sudan World Health Organization Office, organized an educational campaign on the dangers of smoking at Nile Modern Secondary School in Juba. United Nations Association of South Sudan Media Committee spoke to some Juba residents about shisha smoking trends.
How to leave cigarette itself is a problem. It needs days, months, and a good period of time. To leave cigarette is your own decision. Before I was smoking shisha, I was smoking a lot of cigarette. I left cigarette by buying a package of sweets as an alternative when the feeling of smoking comes. I wanted to use the same technique to stop cigarette. I used to smoke 3 packets of cigarette each day. So this smoking for human body is not right.
Shisha is more stronger than cigarette, actually, because cigarette is just smoke. You can smoke it for like 1 minute, 2 minutes you can finish. But shisha, it is even very big. The way you see the smoke coming, it is actually carrying a lot of nicotine. So it is totally stronger than cigarette, because shisha has different types. You have this, they call it tofa, nana, jirat is the most difficult one, most stronger. So if you smoke that jara, I think if you are not fit, if you are not like you don't have enough energy, you can even sleep or what, which is very terrible. I think for me, I can say cigarette is less stronger than shisha. Shisha is the stronger one. So I always advise people to struggle to stop the two things, cigarette and shisha, because they are so harmful.
Shisha, also known as hookah or water pipe, is a way of smoking tobacco mixed with fruit flavors and molasses sugar through a bowl and a tube. Shisha has its origins in the Middle East and Asia and has recently become very popular in South Sudan, especially among women.
I started smoking since 2009 up to now. I started smoking shisha when I saw some young sisters smoking. I wanted to know what shisha will do to me, and up to now, there are no results. I can't sleep without shisha. If I have money, I buy shisha, but not food to eat.
A World Health Organization study has suggested that a 1-hour session of smoking shisha can be the same as smoking 100 cigarettes. We spoke to the Juba State Health Minister, Dr. James Jada Eluzai, about the tobacco regulations in place.
But at the moment, at the state level, we haven't enacted any law or bylaw that prohibits public smoking. My message is to abstain from smoking as much as possible, and if you cannot completely do that, it is advisable to smoke a little number of cigarettes per day, and to avoid smoking in public places and to avoid disturbing others. But otherwise, for a fit, healthy body, you need to stop smoking completely.
Laws regulating smoking in public places, which will protect the health of non-smokers, have not been enacted. Efforts by the former Environment Minister Honorable Deng Deng Hok in 2014 October to ban smoking in public places with a proposed fine of 1,000 SSP has yielded no result due to failure of implementation. Numerous non-smokers are therefore exposed to the dangerous effect of second-hand smoke. The World Health Organization will continue to decampaign smoking in order to tackle the tobacco epidemic.